Good afternoon. Welcome to Thursday Live with me, Vinod James. Welcome to 𝐻𝐿𝐬𝐬𝐢𝐳 Academy Reading. Hope you're all having a lovely day so far, right? And for us, it's always lovely. Every time when we come in front of you all, it's one of the most loveliest and the happiest thing that you could ever do. Even though, right, we have a focus, we are very much determined on the aspect of making sure that you all reach your dream destination. And yesterday also we were so privileged to hear from all those students who have made to their dream how much of an effort that they have put through, isn't it? And it was so nice to see a lot of happy faces, especially with, we are so proud to conduct every time the winners meet. From where they were and where they are, that difference is, you can't really say it in words how much of a gratitude we have for them to, reach that country. It is something which, it's a great feel that I would definitely say to know that, yeah, I am going to my dream country. I'm going to make my dream a reality. So Sidhu, good afternoon. Bangalore. Atira Sally, good afternoon. Joyce Nobin, good afternoon. Sorry, good morning. Monica Vegas, good afternoon. Just small George Gutti, good afternoon. Anit, good afternoon. Nisha Libin, good afternoon. Jilmi Joy, good afternoon. So nice to see that all of you are eagerly waiting as we all are, because when we open the live, eager to know what are the number of students, how many are going to be there, how many of them are regular, how many of them are new. Rajita Rajan, good afternoon. Shiny VS, good afternoon. Adam Vipin, good afternoon. Maria Chinnabattini, good afternoon. Dance Joseph, after some time, good afternoon. So nice to see all of you, and also nice to have, that beautiful icons next to you. There are 1, 2, heart shape, hand, flag, share, everything is there. Clarina Fernandez, good evening. Kalyani Rajagopal, good afternoon, and you name. So if you are attending the live for the very first time, please do let me know that where you're from, because I love to know where my students are from. Savit, good afternoon. Right. Arilondo, who is attending for the very first time, and also you should know what 𝐻𝐿𝐬𝐬𝐬𝐬𝐬𝐻 Academy has in store for you. We are giving training for n number of exams that all of our lovely students aspire for. Okay, we keep on giving whatever that we could, however that we could, in order to make sure that you all reach your dream or attain your dream, achieve your dream, come what may. Kavita Balaji, good afternoon. Renita Johan Raj, good afternoon. Right, we give training as I've mentioned, and if you have any queries that you want us to clarify, there's a number on the screen. Please do not hesitate to contact. They would be happy to assist you. March, April, May is where our next admission, our regular batches admission. We have regular batches, we have crash courses. You wanted us to begin crash course, we have started. You wanted us to take other exam perspectives that you could go to your dream country, we have started. You wanted us to come and give you more reading, we have obliged. There is my colleague coming every Monday with reading as well. Then we have, you wanted us to give more insights on listening. Our colleague is coming again in front of you with listening. Neetu Madam, of course, comes on in front of you with writing, and we have started speaking as well. So what are you looking for? Let us know. We will do the needful. Okay. So we have few social media platforms that you are always welcome to show the support. Okay, we have WhatsApp channel, we have Telegram pages, we have all the very same page that you're watching. If you have not yet click the like button or click the subscribe button or click the follow button. Please do. That's the only thing that we expect, because we want to make sure that whatever that we are doing, only if you like it, you will do that, isn't it? So we expect you to show that. And you can see even in Telegram page, okay, we are about 50K. That means regular students, not the people who have cleared and reached to their dream. These are all students who are there showing us every time. Cincy Gino, good afternoon. Manju Eti, good afternoon. Sibi Sam, good afternoon. Prajisha, good afternoon. Manisha, good afternoon. So a lot of new names, as I mentioned, but still nobody have told me that you're new. So that means you have been there before. If you are new, do not hesitate to let me know, because I love to tell that whatever that a new student, however they come, it's all because of another student share. Okay. So if you feel that my classes are beneficial, please do not hesitate to share on your social media platform as well. Ria Teresa, good afternoon. Tangasudha, good afternoon. So today we are again going back to the time perspective. Say students generally, even though, yes, we have 15 minutes of time, but it's not just the whole 15 minutes that we have, isn't it? In 1 to 2 minutes, you have to skim. So you're left with about 13 minutes of time. Now, where are we lacking? I've told you a number of things what we have to do on a daily basis. And the most important thing is about having reading as a habit. Rinsi Varghese, good afternoon. Geetu Soni, good afternoon. Susanna, good afternoon. Subarna, good afternoon. See, reading habits. Apart from reading habits, what are the other things that you have to do? See, another important thing you have to always remember is you have to set yourself a time. Okay. Sumi John, good afternoon. Why setting yourself time is another important factor in order to tackle that 8-minute target. Let's say yesterday we did it in 13 minutes. Okay. Now, next day when you're doing, Naisha Joji, good afternoon. Next day when you're doing, should we keep 13 minutes? No. You try to bring it down to your timer to 12 minutes of time. Aina Rajanish, good afternoon. Understood? Now, this is the next thing that you have to do in order to reach that 8 minutes of time. You have to push yourself. You have to push to that extreme. Now, how would you push to the extreme? You have to bring down. Keep a timer in front of you. Okay, it can be a mobile, it can be whatever the gadget that you have. Keep a timer. Let's say yesterday I did it in 13. So today I'm going to put it as 12 minutes. GB Varghese, good afternoon. So what happens? You'll push, because as the time clock, you might not even realize, okay, the time. You will look into it, okay, I have only 2 minutes more. Then you start a bit more, urgency is coming. Understood? Next day what happened? Okay, today I finished in 12 minutes. So next day what you do? You put your timer to 11 minutes. Understand? And it's not to show to anyone. It is only for us. You are going to challenge. You are going to compete within yourself. Clear? Anuan, good afternoon. Praveena Akshay, good afternoon. Betsy Benny, good afternoon. UK, no Betsy Benny? UK or Ireland? Kurian Thomas, good afternoon. Anumol Babu, good evening. All right, a very good evening. So, come what may, a very good morning, a very good afternoon, and a very good evening to all my lovely students. So, I've told you about pushing yourself with time. Okay. Now, try to always do it with time. Don't keep it 15 minutes all the time, where you are a bit more reluctant. So what you do, every time, whatever the time that you have completed the previous day, put a minute less today. Understood? Let's say at times when it goes to, what do you call, a bit more of a lower time, what you do, you reduce it. Understood? Sneha, good afternoon. Fajar, I don't know what is that reference, but I hope you are all doing good, whatever that you're doing. I don't know what it is. But again, and be aware of people who are here as fraudulent people as well. Okay, they try to make you lose focus on what you're doing. They will simply message you with some unwanted things. Of course, you have to know what do you do? Simply ban them. That's it. We have to be cautious and do report. We will never message you. That is one thing for sure. Okay. So you have to always be aware. There are fraudulent people right in front of you who are here with, who doesn't. I always tell them these are people who doesn't have backbone because they are only here trying to live with somebody else's money. Isn't it? Those are called leeches. So when they message you saying that, okay, come, I will give you this, I will give you that and all, simply report them and block them because they have no other job. This is the only job. Understand? So because it's an online, you will have fraudulent people. Just ignore and report them. Now, please do try on the aspect of competing with yourself till you reach that 8 minutes barrier. Now, let's say today I was not able to complete it within 12 minutes. Tomorrow also what you do, keep that same 12 minutes so that you will reduce it. Okay. Then once you attain that 12 minutes, bring it down 1 minute. That's how you reach that 8 minutes barrier. Clear? Right. Rashna Suraj, good afternoon. Excellent. So are you all ready for today's session? Yes. If so, give me a quick thumbs up. And also just a quick insight about, see, when we do the material and all, please do not type the answers. Okay, I'll tell you when to type the answers. Once you have finished with the time, what do? You just put a thumbs up or say done. That's all what I need. Okay, I'll ask you when to type the answers. Rose Sebin, good afternoon. Jismol, yes. Okay, fair enough. Rajita, yes. Good enough. Renita, yes. Good enough, good enough. Tangasuda, ready. Betsy, ready. Sabit, ready. Shiny, ready. Kavita, ready. Okay, good enough. Monica Vegas, ready. Good enough. Swapna Soni, good afternoon. Kalyani Rajagopal, ready. Ayana, ready. Joyce Sinobin, ready. Manju Eti, ready. Pravina Akshay, ready. Suzama, ready. All right, as you have all said, Maria Chinnabatini, ready. Neetu George, good evening, ready. Good enough. Sinini Clay, after some time, good afternoon. Kurian Thomas, ready. Princey, ready. Right, now because you have all said ready, 𝐺𝐵 is saying ready. The material will be popping up. CB Sam, yes. And Geetu Soni, ready. Once the material comes, there will be a timer as well. So please do manage the time. Okay? Don't wait. There you have the material. Please do it and then we will discuss. Okay, time I've just eluded, but I was so happy because Naisha, the first one to say done, Suzama done, Nisha done, Rajita done, Jismol done, Tangasudha done, Monica done, Kalyani done, Pravina done. Good, good, good. These are students who have done honor before time. I hope all of you have an answer. Yes, Neetu George done, Joyce done, Renita done, Aina done, okay. Shiny done, Maria done, Cincy done, 𝐺𝐵 is done, Betsy done, Geetu done, Jilmi done, okay. Good enough, good enough. Reha, good afternoon, little bit late, done, okay, fair enough, good, good, good. Yeah, I always love that enthusiasm with all these students come because I know that you're all working, but still you try to attend. Hats off to your commitment. Right, now would you be kind enough to tell me what is your answer and where you got that answer from? That where is very important because we always believe in coming and correcting you from where you went wrong. If you have gone wrong, if you have gone right, absolutely appreciated. So tell me, what is your answer and where you got that answer from? See from the last few sentences, okay, fair enough. So first answer I get is from Susama, who's saying C. Neetu George is the first, I'm sorry, Neetu was the first one to say C from the last few sentences. Susama is saying C from the whole para. Kalyani Rajagopal C. Reha C full para. Okay, good enough, good enough. Monica Vegas C. Rajita Rajan C. Last section. Naisha C from the whole para, Aina C from last part, Betsy C from last line, Cincy C, 𝐺𝐵 C. Tangasudha, Rasna C, last sentence, Renita C, last sentence, Anisha C, Joyce C, especially last sentence, Jismol C whole para, Anumol Suraj C, Atira C, Ushas Vinod C, 𝐶𝐵 C, last para, Savit C, okay, very unanimous answers again, Shiny VSC, last sentence, Anjo C, okay, fair enough, fair enough. Preeta Shahji, C. Pravina Akshay, C from the whole para. Geetu Soni, C from the whole para. Right. Susan, C after however. Okay, fair enough, I like it. Jyoti Sumod. See, a lot of new names, okay, but I'm happy that at least you are shooting your answers. Fair enough. Now, let's see what the answers are. Nimya Krishnan. Hi, good morning. Hi, Nimya. Muniyasamy, good afternoon, sir. Good afternoon. B. Okay, now I have a different answer. B. Nimya done. Okay. So I have the majority of people who's saying B. I'm sorry, C. Muniyasamy is saying B. Nimya is saying C from the second last sentence. Okay, fair enough. Kurian Thomas is saying C from the last part. Yeah, not last para. We only have one para, so it's the last part of that. Now the material will be popping up and then we will see what is the answer. Okay, so when you're doing part B, you always have to remember, please read the question, understand the question, underline the keywords of the question. Very, very, very important. Now let's see what the question is there for us. Okay, so the question is clearly saying what needs to be considered. Okay, so they're clearly asking what needs to be considered when recommending the use of cough and cold medicines in children. Okay, they are saying something should be considered when you are recommending. Okay, now after this you have two options. You can read the paragraph and then pick an answer, or if you're like me, I want to read my answer options so that I can pick it up from the paragraph. So I read my answer option, underline the keywords in the answer option, then I pick it up in the paragraph. So here, very simple, possible dangers, low success rate, age of the child. So is it what they are gonna recommend? So cold and cold medicines for children. Okay. Now, health professionals are advised of the following. No changes have been made to scheduling over-the-counter OTC cough and cold medicines, and a prescription is not required. Basic entry. However, these kind of cohesion markers are quite challenging. Okay? A recommendation for the treatment with these medicines in a child under 6 years of age constitutes off-label use. So off-label use means, anybody know what is off-label use? It means unapproved use of an approved drug. It's called off-label. Okay? So use. These recommendations for treatment should not be made without serious consideration of risks and benefit. So they are saying, even though, yes, OTC, it hasn't changed. However, a recommendation for treatment with these medicines in a child under 6 years of age constitutes off-label. Off-label means, okay, Anil Kumar, I am Anil from Bangalore. I'm attending for the first time. Thank you very much, Anil Kumar. Welcome to 𝐕2𝐧 Academy, 𝗏𝐺. I have a lot of students from Bangalore nowadays. Very happy. Good. I have answered C, last sentence. Okay. Thank you very much. Now, off-label. Now, this is quite an important word. That means you are the unapproved usage of an approved drug. So that is a bit cautious. Okay. These recommendations for children for treatment should not be made without serious consideration, because there are going to be risks and benefits. So you need to consider the risks and benefit when you are doing it off-label. There is no robust evidence of efficacy of these medicines in children, and there are a number of safety concerns. So they are talking about a lot of issues now. Okay. While the safety concerns are lower in children aged 6 to 11 years than in children aged less than 6 years. So something of a success rate is what they are talking about. Okay. They should be taken into consideration when advising parents on the management of cough and cold. Which should be advised? Which should be taken into consideration? There are some risks and benefit and some safety concerns involved when you are doing off-label. That means unapproved usage of approved drugs. So now see, possible dangers. See, not only dangers, isn't it? They are saying it is their benefit also. So it is not the only thing to be considered. They're not saying they're dangers. You have to check when you are recommending. If you are recommending that, will you recommend the possible dangers? Not necessary. So that is a straight eliminator. I'm just gonna. Okay. Now, most of my students said the age of the child when recommending the use of cough or cold medicine. See, they have spoken about 6 years, 6 to 11, but that is not the consideration that you have to recommend when using the drug. See, they are saying when, however, a recommendation for treatment with these medicine, which medicine? Over-the-counter medicine for cough and cold in children, especially when it is off-label. What happens? You should take it into consideration, the risks and benefits. So that means there is some problem. What is the problem? There is no robust evidence. Robust means having exhibited a very strong evidence of the efficacy. That means it is not efficient. There is no strong evidence of the efficiency. So what happened of these medicines in children? Because there are number of safety concerns. So that means you should recommend, when you are recommending cough and cold medicines, the consideration should be on the aspect of their low success rate. So you should, that is why they are telling you should take it into consideration when you are advising parents on the management of coal. See, you should tell them, okay, see, there is a low success rate, especially with whom? Children who are under 6 years of age. That is okay for people who are between the children, the pupil who are in between 6 to 11. So congratulations, the majority of my students today got it wrong. Understood? So the answer is, when you are recommending the 𝐻 and who needs what to be considered, you are thinking on the aspect of what you understand. What needs to be considered when recommending? Who's going to recommend? Are you going to recommend? From the passage, you have to understand, not what you infer. That is why you have to read and understand. The question is very simple. Provided you understand what is it. See, what needs to be considered by you or the people who are recommending the medicine to them. See, off-label. Off-label means unapproved usage. Those people should always tell, see, there are, how C eliminated. C is not talking. The age of the child is not the consideration when you're giving cold medicines. They are not saying, if you're 6 years old, are they going to give the cold medicine only? Or are they going to give you 6 to 11 only, they're going to give you cold medicines? No. Understand, this is not keyword reference. Understand, you are saying, okay, 6 to 7, less, more safety concern, 6 to 11, no safety concern. That is not the recommendation. Clear, Geetu? So this is not the age of the child which is considered when recommending the cold. They are giving to both under 6 and over 6. Okay, but they are saying you should tell them when you are recommending, see, this is off-label use, you are recommending them, see, there are certain risks versus benefit. So there are a number of safety concerns. That means it has a bit of success rate issue, especially children who are less. It is not, it is okay considering when you are 6 to 11. They are not saying the age is the consideration when recommending the children. They are not saying, okay, cold medicine 6 to 7, take it. 6 to 11, take it. Less than 6, don't take it. That is called recommending the age of the child. You have to relate it with the question. Clear? So I think Muniasamy is the only person who have told the right answer. Absolutely good enough, sir. This is why you have to always remember, whatever is your answer, you should be proud enough to say, this is my answer. Because like this today, Muniasamy is on the epitome. That means at the crux, isn't it? He got that answer right. Clear? Tricky one, yeah, of course. See, it is not tricky, Betsy, because what we do is the problem. We refer keyword only. 6, underage 6, 6 to. Question to the question. When recommending, who's recommending? We are not recommending. From the text, when you're recommending a medicine to the child, what should you consider? You should tell them this has a low success rate, especially with people who is less than 6. That's all. Clear? Good enough. I'm so happy that you're taking it as it has to be. Okay, because we are here to learn. That's a fundamental thing that you always have to remember. Good enough, Anil, clear. Everybody have said clear. Kalyani, understood. Neetu George, congratulations, the person who got the correct answer. Very good, I like that. That's called the importance of congratulating the person who have got it right, as well as to have that heart to go and tell them, see, fair enough, isn't it? I appreciate how you have got it. Good enough, good enough, good enough. Keep it up. So, are you all ready for today's part A? What is today's part A? The name was a bit, like 𝐴𝐶 Blackmore Tube. Okay. Muniasamy, please appreciate yourself. It is because of you and your hard work. Okay, I'm just a torchlight. You are the doer. Right? So pat your back. Congratulations, sir. Tube 15 minutes tricky one is the first review I get, Kavita Balaji. So I want all of you to tell me how you felt about today's part A material. Very tricky is what Monica is saying. Just small, yes, sir, ready. 15 minutes, easy material is what Renita is saying. Not easy is what Tangasudha is saying. Just small is saying tricky one, 15 minutes. Okay. 𝐴𝐡𝐚𝐴 Blakemore tube. Something of very, like you're saying something which is a very, something which is more prominent kind of thing. But Neetu George, sir, in between I got stuck in part A. No problem. With your effort, you will. When you get stuck, just take a deep breath. It'll be okay. Okay, it's just that unwanted blockage or a hindrance that you keep on putting on your brain. Keep yourself relaxed. When you take a deep breath, it just subdues whatever that you do. That's it. Susama tricky. So basically today, tricky material is what you have in front of you. Yeah. V.R. Robin is also saying 15 minutes difficult. Okay, generally after some time, because usually it was all easy. Now let's say, see, as I mentioned, it is about our exposure to that particular name and all those things. Now come what may, the material in part A, you have to always know what is your strategy. If your strategy is there, doesn't matter. You will definitely see once we start telling the score. Let's see. So part A, a strategy is called skimming and scanning. Okay. So skimming means you're going to quick read it. Scanning means you're going to check in detail. You're not going to check in detail everything. Once you refer the keyword, okay, now you found, okay, the keywords are here. Now in that area, you are going to scan, not everywhere, okay. Now how are you to do? Generally for 8 minutes of time, 15 seconds, you have to skim through the text of each text. We have 4 texts based on one common theme. So that is another thing which you have to always be cautious about. Okay, skimming means underlining keywords. What are the keywords? Everything you are more sure. If you are not yet sure, just go back and see what we have done an exclusive video on the aspect of how to improve on your part A. Just refer, and you're always welcome to clarify your doubts. Okay, we are here to assist you. I'm just going to show you how to do. So saying a tube is a controlling bleeding and esophageal gastric varices. Then the esophagus and stomach lining and the blood flow problem. The most common cause of the liver cirrhosis is scarring and scars on the blood vessels or squeezed blocked off in the liver in your digestive organ and the pressure in your stomach and the lower exposed vein, and this causes life-threatening bleeding. Bleeding can also be caused by sores, ulcers, gastric wound, tear in the lower esophagus, mallory waste tear, a tumor. Your doctor may use the 𝗏𝐻 to stop bleeding. Medication, injection, veins, ligation, tie off, if it doesn't work, then you are going to use this. So done. Likewise, you're going to do B, C. So before they place it, so what are the procedures that they're going to do? Text C is about a study. Text D is about complication. And you have to go through it, but I'm just saying how quickly you have to. Then, there is only 15 minutes. 20 questions. These 20 questions are divided into 3 different types of questions. You should know what are the types of questions, what are the numbers that start, and the information, the instruction that is there that you have to always remember. Okay, so 1 to 7, these type of questions are called match the following questions, where the instruction clearly says you are expected to write any of these letters A, B, C, D, and you may use any of these letters more than once. Okay, now if your skimming is proper, your underlining is proper, 1 to 7 is just a piece of cake. I always remind my students, because it's purely keyword reference. Part A is only keyword reference. I'll show you why. See, rationale behind the exerting force on the tube after inflation. So the reason or the purpose behind exerting force, that means you're going to put some weight and following. So where are they? It should be during procedure. Yes or no? It should be during procedure. Now, where it is, because I have to show you where it is. Why? They Blakemore inflated, they will apply the weight to the tube for traction. This makes the tube stretch a little. So that is where the weight is applied. Good enough? Now see, in what circumstances that the greatest risk of inhaling, breathing. So where are they talking about all these complications? So where are they talking about complication? D. Understood? Now, because I have to show you where. So Inhalation means what? Aspiration is the same thing, the greatest risk of during insertion. So that is there. See, you have to always remember these kind of things, okay? Successful cases of bleeding control reported. Report C, isn't it? Study. Done. Now where? How many successful cases of SBE tube is this? So that is it. Okay, now what diverse factors contribute the occurrence of hemorrhage? Hemorrhage means what? Bleeding. Where are they talking about bleeding? A. Why? Bleeding can also be caused by a lot of reasons are mentioned. Conditions precipitating the inflation of gastric balloon resulting in perforation. So perforation as a word, it is only mentioned in D. Why? Esophageal perforation. So balloon is there, inflation is there, all those things are there. You don't have to worry about it. Now, clinical scenarios advocated prior the utilization of Sengstaken-Blakemore tube. So again, it should be A, isn't it? I was just trying to remember. Clinical scenarios advocated prior. So where are they talking about all these scenarios that is needed? Because your doctor will use method first to try to stop bleeding, like medication, injection, vein, ligation, or tie off of varix. That is before they're going to do this. So A. Therapeutic approach. Therapeutic means medicinal, okay, with the minority presenting with variceal hemorrhage. So where is variceal hemorrhage? It is there. Minority, major is 44, 46 people excluded because of this. So minority using SB tube mentioned in C. Understood? Now I have done my 1 to 7, 8 to 14. These are called short answer question, where your instruction is, it can be as simple as that of a word, a short phrase which expects you to write anything between 2 to 3 words, or number or numbers, or both. Okay, strategy doesn't change. You're going to refer with the keyword. What is the intervention performed to avert asphyxiation? So what is asphyxiation? Where are they going to talk about? They are simply going to say that in asphyxiation as such is there in B. So now where is the thing? What is the thing? So it's a proximal migration of the tube and can prevent with endotracheal intubation. INTUBATION. So endotracheal, ENDOTRACHEAL. So it's a 2-word answer, but I like to see a lot of 7 out of 7, but also 6 out of 7, which is quite good. Keep it up. For what duration, time frame, the tube employed in management of bleeding? So where are they talking about? During procedure, isn't it? The tube usually are in place for 24 hours. The doctor will use other method to fix the bleeding. So 24 hours. Good enough. What term describes the lower esophageal incision leading to the life-threatening hemorrhage? So life-threatening hemorrhage, bleeding, where are they talking about all these things? They're going to talk about in A, bleeding is there. So bleeding is here. A tear in the lower esophagus may be called as Mallory-Weiss tear. So MALLORY-WEISSTEAR. Good enough. What instrument is employed to extract fluid, inspect for blood beneath the balloon? So there should be, again, during the procedure. So what are they going to do? Yes, they're going to, what is being checked? So they will use a gastric suction port to pull out any fluid check balloon blood under the balloon. So it's a 3-word answer, gastric, GASTRICCUCCTION What factors, singular, plural, you have to always remember, factors contribute to the formation of erosion and ulcers, pharynx, gastroesophageal region. So what are the causes? So they are saying the most common causes of these varices are liver cirrhosis, scarring. So all the other keywords are there, isn't it? I'm sorry, what am I saying? Sorry, not that answer, okay? The responsible for pharynx It should be there in D. So where are they saying? Pharynx is here, gastroesophageal is there, erosion is there, ulcer is there. So local pressure effects. So the question is clearly asking you, what factors cause you? So the answer is local pressure effects. Good enough. Very sorry. Question 13. What are the predominant etiological factors that occurrence of gastric varices? So this time is where I said the most common causes of these varices are liver cirrhosis, scarring. So straight answer. Now, the diagnostic methodology. So diagnostic methodology used to appraise the existence of variceal hemorrhage in a cohort. Cohort means go straight to C. So what is the diagnostic methodology? Endoscopy. ENDOSCOPY. Clear? Now for the final set of questions, these are called fill in the blanks question, where the instruction is it can be a word, short phrase, anything between 2 to 3 words, number, same as what you did in short answer but redundancy. The mitigation of dash risk involves emptying stomach before tube placement, uphold conservative approach towards endotracheal intubation. So endotracheal intubation, where? Go to D. So endotracheal intubation is here. So what is the thing which is going to talk? So they are saying here also they are saying endotracheal intubation. So what are the things that you have to? The risk of aspiration can be minimized by evaluating stomach prior to placement. All the other keywords are there for endotracheal intubation. So aspiration, ASPIRATION. Elevated, that means increase high in stomach esophageal blood vessels. So the formation of varices characterized by the enlargement of veins culminating life-threatening blood bleeding. So where are they talking about? This should be there in A, isn't it? Life-threatening bleeding. Yes, it is. Stomach is there, esophagus is there, varices is there, veins is there. So the only thing which is missing is pressure. PRESSURE. To achieve dash, healthcare providers exert a specific force on the tube immediately after its inflation. So weight, pressure, all those things are there. So during procedure, so where are they saying? They're saying they apply a. So where are they talking about? They're saying once the 𝐴𝐶𝐭𝐫𝐿𝐴 tube is inflated, they will apply a weight to the tube for traction. TRACTION. The erosion of the dash, a complication resulting from creating a small pouch in stomach. Small pouch in stomach. It's a very nice usage, isn't it? That's called gastric banding. Potential contributor for bleeding occurrence. Bleeding occurrence, go to A. Now see where are they talking about. Gastric banding, erosion. Erosion is already there. Complication of gastric banding is you're tying your thing like this so that only a small part is open so your stomach feels full. That's called gastric banding. So gastric band is the only thing which is missing. So the answer is erosion is already there of the gastric band. Very good. So inflating a gastric balloon mistakenly placed in the esophagus can lead to. So something is happening. So where are they talking about? Again, it should go to where? D. So they are saying erosion, complication, all those things. Where? So they are saying the esophageal, perforation. So where are they talking about esophageal perforation? Here it is there, rupture is there, gastric balloon is there, advertently placed in the esophageal balloon, everything. So esophageal perforation. ESOPHAGEALPERFORATION. The ultimate question. Out of the instances where bleeding controls were achieved successfully, so go to C is what I feel. Dash patients encountered rebleeding resulting in the demise of 6 individuals. So 6 individuals demise. Here it is there. It is 16. Here also it is there. Now rebleeding no rebleeding. So this is not rebleeding. So how many patients? 11. So this is how you find the answers referring keywords. So I have done my 20. I've fired all the 20 answers. It is high time that you tell me what are your total scores, or if you have any doubts with regards to anything that I've told, you are always welcome to clarify. Renita John, 19. Good enough. Excellent. Keep it up. Maria, 18. Very good. Keep it up. You all said difficult, tough, challenging, but 19, 18. Gitu Sony, 17. Good enough. Jilmi, 17. Good enough. Pushes, 18. Good enough. Jismol, 17. Good enough. Keep it up. Aina, 19. Good. GB, 19. Good enough. Monica, 18. Good enough. Keep it up. Anit, 15. Okay, fair enough. Good enough. You have to, no, from tomorrow when you're doing Anit, what you do, you try to focus to get 16. That's how we learn. Yeah, do not worry. Sabit, Shiny, 16. Good enough. Same. Good enough. And if you can go back and see how many silly mistakes that we have made, your score will always be hovering about 18. No worries at all. Betsy, 16. Good enough. So if there is any doubt with regards to what I've just told, anything that you want me to clarify? Thank you. Monica saying thank you. Okay. So because you've started saying thank you, it's high time that I start saying thank you. Until and unless I see you all tomorrow, adios from me. God bless you all. Take care. Bye.